Hello everyone, I'm Frank. Welcome to my channel. Today I want to share the injection method of eyebrow lift. One of the common struggles of new injectors is how to get a brow lift. So here are the injection points to create a brow lift. If you do this on all of your patients, you will get okay results on most of them. But every face is different. Every treatment needs to be designed around the nuanced differences between each patient. Their age, muscle strength, sex, eyebrow shape, and the desired results. What we need to understand are the principles from which you can appropriately design a treatment for any face. First, the shape of the ideal female eyebrow, because it's usually females that we are lifting eyebrows on. The medial border should be linking the alar base, the inner cavus, and the head of the brow. The tail of the eyebrow should be on a line that runs from the alar base through the lateral cavus to the end of the tail of the eyebrow. And the arch of the eyebrow is typically on a line running from the alar base through the pupil to the arch. So how do we decide where to inject the forehead? We now need to space our injection points evenly to effectively cover the area which we wish to relax. The first principle we need to understand is how far does botulinumtoxin spread from one point of injection. With a dose of 1 to 2 units, I estimate about 1.5 cm circumference to effect on the muscle. To spread them evenly, I work by dividing the area up, first in half and then in half again. Place my planned injection points at logical positions, so that in the end, I fill the space efficiently and symmetrically. It's vitally important laterally that you are symmetrical. If the face is symmetrical, small changes in the position of your lateral injection leads to large changes in the relative size of the untreated muscle, which means the relative size of the lift. Therefore, the injection site should be as precise as possible. Injection points of the glabella and the orbicularis oculi, in most cases, fit the licensed positions very well and will contribute some of the overall lift to the eyebrows in a 3-area treatment. Overall, there are several grades of brow lift that we can create. A mild lift by injecting 2 to 4 units into the tail of the brow. A mild to moderate lift caused by injecting orbicularis oculi muscle more comprehensively. A moderate lift by treating the front tails and glabella together. And a maximum lift caused by treating the medial front tails muscle, the orbicularis oculi muscle, and the glabella. Remember, one of the most important factors is the degree of muscle which is left untreated in the front tails, so that you can adjust a lift that is too strong, simply by adding a little more to the top of little cat ears to soften a lift. I recommend 1 unit right into the tip of that little cat ear. You can also treat orbicularis oculi as the follow-up to get more of a lift if you have any down glabella and front tails at the first treatment and not satisfied. So this is what I shared today. If there is anything you do not understand, you can leave a message below or privately message me. If you're interested in what I share, please don't forget to subscribe to my channel. See you next time.